my name is Shane Yang and this is my health assessment video. I'm going to do a full head to toe assessment on you today, ma'am. Is that okay?
Yes.
Okay. Can you tell me your full name, please?
My name is cranial.
Okay. And can you tell me how old you are?
51.
Okay. And when is your birthday?
1568.
Okay. And do you know where you are right now?
I stay home.
Okay. And do you know what the date is today?
Today, September 8th, 2019.
Okay. All right. The person is alert and oriented to place, person, and time. How is your eating these days?
Yeah, I eat, yes.
You eat good?
Yeah, really good.
Okay. All right. And she's sitting upright, and there does not seem to be any physical deformities, and her mobility is not limited at all. Her facial expression is appropriate for the situation. Her mood and affect is appropriate for the situation. Her speech is clear and appropriate. Her hearing is not difficult at all, and her personal hygiene is clean and kept. All right. First thing I'm going to start off with is just your height and weight. How tall are you, ma'am?
4'11",
4'11". Okay. And how much do you weigh?
129.
129 pounds. Okay. So the next I'm going to do is just vital signs on you. I'm just going to check your pulse, respiration, blood pressure, and pain level. Okay.
Okay.
All right. First thing I'm going to do is I'm just going to check your radial pulse. So how I do that is I just feel for your pulse here at your radial, and I'm just going to count to 30, and once I get to 30 seconds, I'm just going to multiply it by 2. Okay. And I got 72 for your pulse, and it is regular. And now I'm just going to check for respiration. And I'm going to do that for 30 seconds, and I'm just going to multiply that by 2. All right, and her respiration was 18, and it was even and labored. All right, now I'm just going to check her blood pressure. I'm going to use this cloth as my prop for today, as my blood pressure cuff. All right, is that right arm okay to use, ma'am? Is it good to use?
Yeah.
Okay. And what I'm going to do is I'm just going to check for the brachial pulse once I inflate the balloon up. So I'm just going to put my stethoscope by the brachial pulse here. I'm just going to pump up my blood pressure. And then I'm just going to let it go and listen for it. All right. Your blood pressure was 120/80. That is good. When you were sitting. And do you have any pain today at all, ma'am?
No.
And on a scale of 0 to 10, 0 being no pain and 10 being the worst pain, what would you rate your pain?
0.
Okay. Awesome. All right, next thing we're going to do is just check for your skin on your hands and your nails. So I'm just going to take a look at both your hands just to see if there is any swelling, any bumps, any tenderness, any pain. Do you have any pain at all in your hands, ma'am?
No.
All right, and I'm just going to check to see if there's any clubbing, which there isn't no clubbing. And I'm just going to check for a cap refill, and it is good. It's less than 2 seconds. Alrighty. All right, so hands were not swelling, no moisture, no clubbing. It was not yellow. And then cap refill was good, like I said. And I'm just going to take a look at her overall skin, and it is consistent with her ethnicity background. Do you have any lesions or sores at all on your body?
Okay.
Okay, none. Okay, and I touched her. She is warm and dry to touch, and her skin is smooth and firm, and skin turgor is good, non-tenting. All right, next we're going to move on to the head and face. So I'm just going to go ahead and take a look at the head. I'm just going to palpate it just to see if there's any lesions, lumps, scaling, or any evidence of trauma. And while I'm touching you here, her, do you have any pain at all?
No.
Any tenderness? Okay, awesome. So the scalp in here is good. Now I'm just gonna check for cranial nerve 7. Can you smile for me? Can you frown? And then can you show me your teeth? And then can you puff your cheeks with ear and blow out? And then blow out? Okay, awesome. So cranial nerve 7 is intact. There is no weakness, no involuntary movement, and it is symmetric. Alright, moving on, I'm just going to take a look at her eyes. So externally, I'm just going to look to see if there's any ptosis, any lid lag, any discharge, crusting. It does not look like there's any. Do you have any discharge in your eye at all, ma'am?
No.
Any pain?
No.
Okay. There is even here distribution. The eyebrows are symmetric and the eyes are symmetric. Now I'm just going to take a look at her eyes itself. Can you open your eye wide? Okay, there's no jaundice in her eyes. There's no lesions or redness. And then I'm looking at her sclera color and it is clear. Now I'm just going to check for pupil reaction. So what I'm going to do is I'm just going to flash a light at her eye and take a look at her pupil. Right. So while I'm looking at rest, it's 4 millimeter, and then when it's constricted, it's 2 centimeters. 4 centimeter, and then it's 2 centimeter when it's constricted. Pupils are equal, round, and it reacts to light. And then I'm just gonna have you take a look at the flashlight here, and I'm gonna move it forward closer to you. Look at it. Awesome. So her pupil is accommodating. Next, I'm just gonna check for her visual field, so confortation. And how I'm gonna do this is I'm just gonna have you cover one of your eye for me, and then I'm gonna have my finger in front of you, and then when you see my finger, say now, okay? And I'm just gonna have this to cover my other eye and to kind of follow you. When you see the finger, say now. Now, okay? Okay, now switch over to the other side. Okay, ready?
No. No. No.
Okay, awesome. So that was confortation, and she passed that. Now I'm gonna so cranial nerve 2 is indeed intact. Now I'm just gonna check for actual ocular muscles. So what I'm gonna have you do is just follow my finger on all visual field. Try not to move your head and just your eyes. Awesome. So actual ocular muscles are intact. Now I'm going to check for the corneal light reflex. What this is I'm just going to put the light between your eyes, and light should be present in both her eyes in the same spot, and make sure that her eyes are symmetrical. And they are. So she passed the corneal light reflex. Alright, next thing is her ears. So I'm just going to go ahead. I'm just going to palpate both of her ears just to see if there's any problems, ear infection, to see if it's red. Do you have any pain on your ears at all?
No.
And is it tender at all when I'm touching it? Any tender?
No.
Is it tender?
No.
And then there is no drainage noted on either side. Double check. So no drainage noted. Okay. And that is on both sides. And so you don't have any complaints about your ears at all today?
No.
No ringing?
No.
No ear aches?
No.
Okay. And do you wear any hearing aids at all?
No.
Okay, so you don't wear any then?
No.
Okay. Moving on, next is the nose. So I'm just gonna go ahead and I'm gonna palpate the nose just to see if there's any discharge, any redness, and I do not see it. Do you have any pain at your nose at all when I'm touching it?
No.
Okay, awesome. So her nose is symmetrical, and there is no discharge or redness that I can see. Okay. And now I'm just gonna check for the patency of her nostril. I'm just gonna go ahead and pinch. I'm just gonna close one side, and can you sniff? Okay, other side. Awesome. So her nostril is patent. And do you have any nosebleed at all? Any history of nosebleed?
No.
No? Okay. Alright, moving on is the mouth and the throat. So I'm just gonna have you go ahead and open your mouth for me. Just open. So I'm just gonna take a look at her lips, her mucous membranes, and her tongue. Can you stick out your tongue for me? Awesome. Okay, you can stick it back in. Alright, and they are all moist and pink. And then I'm just gonna ask you some questions about your dental health. Do you brush your teeth?
Yes.
And how often do you brush your teeth in a day?
2 days.
Two times a day? Oh, that's good. And then do you floss every day? You floss? And how often do you do that?
2
Two times a day? Okay.
times.
And when was the last time you went to the dentist?
July 20.
Okay, so just not too long ago then? Okay, since you just had your dental visit, then you don't have to schedule one just yet. You could probably wait until the 6-month mark to do that.
Yeah.
Okay, now I'm just gonna take a look again at your teeth just to see if there's any discoloration and if there's any caries at all. Open your mouth. Alright, take a look at your teeth. Doesn't look like there's any discoloration. Good job. Alright, and no presence of caries. Alright, and then I just need to check your gums. Sorry, so open your mouth again. Alright, does your gum bleed at all? Ma'am? No?
No.
Okay, and it does not look red or swollen, so that's good. And like I said, your tongue was already moist and pink, so nothing we have to worry about. But the next thing that I have to do is the cranial nerve check for 9 and 10. So this requires me to use my handy dandy spoon as a tool to help me out for this one. Alright, so go ahead and open your mouth. And I'm just gonna put the spoon on the center of your tongue and then say ah. Say ah, okay? And I see that your uvula is intact and that it is in midline. And now I need to stimulate the gait reflex, so open your mouth. Okay, gait reflex is there. That's good. Alright, the next thing I'm looking at is the neck. So I'm just gonna go ahead and just palpate your neck. Is there any tenderness?
No.
Any pain? Okay, that's good. Alright. And then I'm just gonna check your carotid pulse. So I'm gonna check on this side first. Alright, and I'm gonna check the other side. Alright, and I'm just gonna check for the tracheal. And it is midline. So that's good. And now I'm just going to check range of motion and muscle strength of her neck. So can you just pull your chin forward to your chest? Okay, and then lift your head back. Awesome, and then to the side, and then the other side. And then I'm just gonna have you do it again against my hand. Do it again. Okay, this side, forward, and then backward. Awesome, so she does have full range of motion on her neck and equal strength. So now can you just shrug against my resistance? Okay, she is able to shrug against resistance. Alright, moving on is checking posterior chest and lungs. So can you stand up for me, ma'am? Stand up. And I'm just gonna move the chair so we can look. Alright, so I want you to sit here with your back. Yep. No, yep. Turn around. Alright. So this is just checking her thoracic cage configuration. So I'm just gonna go ahead and palpate her back to see if there's any tenderness. Is there any tenderness at all, ma'am? Alright, and then any pain?
No.
Alright, and then I'm just going to check for symmetrical expansion. So I'm just gonna put hand on either side of her rib cage. And can you breathe in for me? Okay, and then there is equal expansion right there. And does not look like she has any barrel chested or use of accessory muscles. So her shape and configuration, symmetric expansion is all there and it's good. Next, I'm just gonna touch hand to your back, and then I want you to say 99 when I put my hand on you, and then that is just to check the tactile firmness. So can you go ahead and say 99 for me?
99. 99. 99. 99.
Okay. And it is equal in all area of the chest for tactile firmitus. Next, I'm just going to check for the CVA tenderness. So I'm gonna go ahead and I'm gonna feel for this, for the kidney, and there's like this angle space under the 12th rib cage, and I'm just gonna tap it. Any pain at all, ma'am?
No.
Any tenderness? Okay, CVA is non-tender. Now I'm just gonna check for posterior breath sounds, and what I'm looking for is vesicular breath sounds, bronchi, crackles, and wheezes. So every time I put my instrument on you, I need you to breathe in, okay? Take a deep breath. Take a deep breath. All right, looking good. Now you can come back and face the front, ma'am. Okay, and I heard vesicular breath sounds on all fields, and her lungs were clear on auscultation. Next is the anterior chest, so I'm just gonna go ahead and palpate just to see if there's any tenderness or pain. Are you in any pain at all?
No.
Okay, so now I'm gonna do the same thing that I did to the back, which is a tactile firmitus. So when I put my hand on your chest, I need you to say 99, okay?
Okay. 99. 99. 99. 99.
Awesome, and tactile firmitus is intact and equal in all area. Next, I'm just gonna listen to anterior breath sounds, and once again, I'm listening for vesicular sounds, any bronchi, crackles, or wheezes. Okay, take a deep breath. Okay, and I heard vesicular breath sounds on all fields, and her lungs were clear on auscultation. Next, I'm just going to palpate for her apical impulse. So I'm just going to go here. And it is palpable. So now I'm going to go ahead and I'm going to listen for the apical heart rate, and I'm going to listen to that for 1 minute. And I got a heart rate of 78, and it was a regular rhythm. And then now I'm just gonna listen to the heart sounds. You could just relax, you don't have to breathe. Okay. So I did hear S1 and S2 sounds and no murmurs, which is good. Okay, so next is upper extremity. So I'm just gonna check for range of motion and muscle strength in the upper extremity. So could you put your arms out for me? Arms out. Okay, and then I need you to put your hand down, and then hand side to the side, and then the other side. Okay, and then I need you to spread your finger apart. Spread it. Awesome, and then can you press against my hand? And then can you pull against my hand? And can you squeeze my hand? Awesome. So she does have equal strength and full range of motion on both arms, and it's equal bilaterally. And then now I'm just gonna check pulses on the brachial and the radial on both sides. So I'm gonna go ahead and I'm just gonna check the brachial pulse on her left arm. +2. The radial pulse now, +2. And check the right side now, +2. And +2. So they're all normal on all of the pulses. Next is the neck vessels. So we're gonna go ahead and I'm just gonna check for presence of jugular venous distension. So I'm just going ahead and just gonna palpate around the neck here. And there is no presence of jugular venous distension. All right, next on the list is the abdomen. So before I even start, put your hand to the side. I'm just gonna assess her just to see if her abdomen is flat, if there's any mass, any bulging, pulsations, and they don't look to be having any abnormalities. And I'm just gonna check for her umbilicus here, and it is midline and it is inverted. So no abnormalities in her on her abdomen at all. Next thing is just to listen to bowel sounds on all quadrants. And while doing this, I'm just gonna listen to see if it's normal, hyperactive, or hypoactive. Okay, and all 4 quadrants were normal. Next on the list is light and deep palpations on all 4 quadrants. So I'm gonna go ahead and I'm gonna do the light touch before the deep touch. And I'm just going to palpate to see if there's any bulges, masses, if it's painful. So let me know if it's painful, okay? Is this okay? Okay. Everything looks good. Now I'm just gonna go a little deeper, okay? How you feeling? You okay?
Yeah.
Okay, so abdomen feels soft on palpation for both light and deep palpation. Next is just percussing on all 4 quadrants. All right, and they all have Tiffany in all 4 quadrants, so it is normal. All right, next is lower extremities. So I'm just gonna come down here and I'm just gonna take a look at both her legs. I'm gonna look for any discoloration. I'm just gonna compare both the legs to make sure that they're equal size and they're symmetrical, which they are. I'm just gonna see if there's any cyanosis, ulcers, any bruises, any lesions, and looking at it and feeling it, there does not seem to be any abnormalities on both her legs. And I'm checking to see if there's any edema, and there is no edema on either legs. So everything on her lower extremity is good. Next, I'm just gonna check cat refill. And cat refill is good, it's brisk, and it is less than 2 seconds. Right, and I'm just touching her legs, and it is warm to touch on both the legs, and no pitting edema, like I said. And then now I'm just going to check for the pulses on her lower extremities. I'm gonna go ahead and do the femoral, which is by the groin area here. It's +2. +2. Next is the popliteal, which is behind the knees. Just gonna feel for your pulse here. +2. +2. Next is the posterior tibial. Just gonna feel for it. It's +2. +2. Next is the dorsalis pedis. +2. And +2. So everything here is +2. It's normal pulses. Alright, next is hips. So I'm just gonna go ahead and I'm just gonna palpate your hip just to see if there's any if it hurts or any of that stuff. I'm looking for pain, tenderness, I'm looking for capitation. So I'm just going ahead, I'm just gonna move it back and forth just for capitation. I don't feel any. Are you in pain?
No.
Any tenderness? No? Okay. So everything looks normal there. I'm gonna go ahead, I'm just gonna check for your flexion. So I'm gonna go ahead and can you lift your leg up all the way up to the ceiling? Okay, and that's 90 degrees. And then bend your knees. And that's 120 degrees. Awesome. Now to the other leg. Up to the ceiling. All right, 90 degrees. Flex your knees. 120 degrees. Good job. Both your flexion and abduction is good. Now I'm just gonna check for your internal and external rotation. So put your legs up, and then we're gonna go inward. Awesome. That's 45 degrees. Check the other legs. Go inward. Awesome. 45 degrees also. All right, now I'm just gonna check the ankles and feet. Check for range of motion and strength. So I'm just gonna go ahead and just gonna palpate it first to see if there's any problems, to see if there's any injuries. Are you in pain at all?
No.
Does it feel tender when I touch it? Do you have any injuries to your ankles or feet at all? Okay, so no swelling, no pain, no tenderness, no ulcers, redness, or edema. So now I'm just gonna check your strength. So I'm gonna go ahead and we're gonna check the plantar flexion. So I need you to put your toes out straight. Okay, now I'm gonna check for the dorsiflexion. So I need you to pull your toes back. Awesome. And then now can you just push against my hand? Okay, and then pull against it. Awesome. So she has equal strength on both sides. All right, now can you just sit up for me for the next one? Next one is checking for deep tendon reflexes. So I'm gonna check in on many sides of your body. So first is the biceps. So go ahead and just relax it. I'm just gonna hit it by the brachial here. Okay. Next one is triceps. So just relax. Hit it right below the elbow there. Next one is brachioradialis. Relax. Just gonna tap it right behind the bone. Awesome. Now I'm just gonna go and do the other side. Sorry. All right. Turn. Okay. And they are all +2, so they're all normal. Next is the patellar. So this is under the knee. Okay, relax your leg. Okay, good. Last one is the Achilles. So this is right behind the foot. So relax. Right by the bone right there. Awesome. So these on the lower extremities were all +2. Okay, next is checking sensation all over your body. So I have a Q-tip here to use as my tool. So one side is sharp, one side is soft, okay? So what you need to do is I need you to close your eyes, and I'm gonna put this Q-tip somewhere on your body, and I just need you to tell me if it's sharp or soft, okay? Close your eyes, start. So. Okay, awesome. So she was able to feel in all the body parts that I put it on. All right, last but not least, I need you to stand up. We are gonna be doing the spine. So stand up. I need you to lean forward and touch your toes. All right, and while you're doing that, I'm just going to palpate your spine to see if there's any pain here. Is there any pain? Bend more. Any pain?
No.
Okay, any tenderness?
No.
And I'm looking at it is symmetrical here during the rise and fall. Okay, you can stand back up. All right. Now I need you to check. We're checking for range of motion in your spine. So I need you to lean back. So we'll go this way now. So lean back. Lean back. Okay. And then I need you to move your spine to the right. Move your spine to the right. And again now to the left. And then move your spine to the side. So move it one side and then other side. Okay, good. She has full range of motion in her spine, and there is no pain with that range of motion. Now, the next thing I need you to do is I need you to do the shallow knee bend. So it's kind of like a squat. So if you could just squat for me. Okay, awesome. You can stand back up. And she was able to do that full range of motion with no pain. Next thing is just to walk across the room normally. So can you walk across the room? Walk. Okay. Turn around. And then now can you tiptoe for me? Yep. Come on over. All right. And then one last time I need you to go on your heels. Okay. And she was able to do all those three appropriately with appropriate coordination with no problems. All right, and you can have a seat here, ma'am. I am done completing your head to toe assessment. Thank you very much. Make sure you follow up with your primary care physician, okay?
Okay.
All right, have a good day.
Thank you.